All right. Well, you're tuning in to Financial Fitness Northwest live on 1150 KKNW. Well, we are here to help you navigate the real estate and mortgage industry, but we're also hoping to provide local businesses and community businesses and charities in your community that can help you bring some awareness to what's going on and give you the opportunity to give back to them as well. And in studio right now, we have Dave Kwok with Hope Central Pediatrics. Dave is the executive director of Hope Central. He has led the organization since its founding in 2011. Under his leadership, Hope Central has grown from a volunteer-staffed mobile clinic to a thriving full-time pediatric and behavioral health practice. He holds an MBA from the University of Chicago, Bose School of Business, and a bachelor's degree with high honors from Princeton University. So welcome.
Thank you very much for having me.
I keep calling you Dave and David. Do you go by
Dave usually?
Okay, good. Well, welcome, Dave.
Thank you.
Welcome, Dave.
Thank you very much.
So, so tell us a little bit about how this got started. What was the inspiration?
So Hope Central launched about 3 years ago, and our team got together about 6 years ago, so 3 years before that. And it really came together from a bunch of different influences. One was just the reality that there continue to be persistent health disparities in Seattle, but in other places as well, obviously. One summary statistic is in Southeast Seattle, life expectancy is actually about 10% shorter than it is in Mercer Island.
Wow.
And so, yeah, there was a team that came together in the midst of that and said, you know, what can be done about this? We're also in an era that where our health system is really specialist focused. It's really geared towards trying to fix problems, usually expensively, after they occur. Mm-hmm. And our team is a team of primary care folks who are looking to see, like, how can we make more investments in primary care and really put more resources and emphasis in preventive care? And so it's like literally those dynamics that brought the team together. There was some existing work in Southeast Seattle where a fitness center called Rainier Health and Fitness was founded. As part of that broader vision, there was space for a clinic, and we grew out of that, sort of that initial visioning.
Okay. Well, wow. So you guys are nonprofit, right? And you're pediatric.
That's right.
So why the need for the nonprofit pediatric clinic?
You know, a lot of times the sort of nonprofit healthcare efforts that you'll see might be geared towards specialty care, like Children's Hospital or something like that, raising money for an acute condition. And a lot of times, you know, what happens in primary care, it's not really as glamorous or sexy in one, you know, in one look. You're really talking about preventing things from happening versus presenting a story of something terrible that you're trying to fix. And but one of the dynamics in that is just along with everything else happening in healthcare is primary care can get a little bit of the short shrift. There's a lot of pressure in primary care for appointments for there to be a lot more volume in primary care practices. Doctors get paid on a fee-for-service basis.
Okay.
So their incentive is to see more and more patients. Mm-hmm. That means your time with the doctor is shorter. It's harder to get an appointment. It's harder to reach them after hours. These are all things that impact the quality of preventive care. And so really the only way to try to turn that on its head was to organize as a nonprofit and say, you know, certainly it's worth it for society to invest in care for acute conditions like childhood cancer and things like that. But it's also important for the community to invest in a primary care setting where we can actually spend the time with patients to get to know them, to get to know their complex health needs, to bring the resources to bear that can really change sort of the direction of a kid's growth and development. And so really that's the basis for organizing how we are.
It's so incredible.
That is. It's really awesome. I mean, that's so true, though. It's like you do kind of feel like nowadays kind of like a number and, you know, and you can only, if you go to your doctor and you have a pain in your knee and your shoulder, you can only talk about one of them at a time, and you have to make another appointment for the other thing because they don't let you,
or be referred to somebody else.
Yeah, it's pretty crazy.
Yeah, that's right.
So what's unique about Hope Central?
Yeah, so we really think about ourselves along kind of two major axes. One is what we call enhanced physician access. So this is the idea that we intentionally focus on a smaller patient panel, a smaller number of patients, so we can spend more time with folks. So practically this means that we're booking half-hour appointments instead of 15-minute appointments. Our well-child appointments are typically 45 minutes long. So it's really enough time to not feel rushed, to not only get all your concerns out with your with your physician, but also have some ability to actually get to know them as a person. So that, certainly is better from an experiential, as a patient, just feeling like your doctor hears you. But it also is shown in the research to improve outcomes, health outcomes. Kind of the second big axis when we think about ourselves is integrated behavioral health. And this is really just the idea of creating a primary care context for mental health issues alongside medical issues. So mental health is one of those weird things where it's just hard to access. There's statistics out there that 25% of all children have some kind of mental health need, and like 4 out of 5 kids never get any help at all.
Wow.
And that's because there's a lot of stigma around mental health issues. It's also mental health is set up more of a specialist system. If you talk to a therapist, you might be talking to them for a long time with a lot of money. Primary care is very different, where you don't exactly know what's wrong. You go and see your doctor, and they help you figure out what's wrong. They address a lot of concerns in the office, and then if you need further care, they help you with that referral. So with a psychologist on staff, they work hand in hand with our pediatricians to create that primary care context for mental health issues alongside medical issues, so that we can address sort of all the issues with the child's health holistically. So those are kind of two of our core distinctives. Beyond that, we found that our core primary care model is a great platform for some select specialty services, mainly focused right now on autism. We're also a faith-based clinic, and we feel like that really gives us great motivation for the work, but also kind of frames our understanding of health as a holistic endeavor.
So, I think it's pretty remarkable that you guys, treat behavioral health or address it at your clinic. So, why, how does that help, in primary, can you go into more depth about if someone who comes in and has a behavioral health issue, comes to your clinic, what does that look like and how does that benefit them?
Yeah. So, one of the main ways that it benefits folks is it puts a mental health professional in close enough proximity that you can actually touch them. A lot of people just never meet a mental health professional. And so it's this idea where when you go to your doctor, especially for children, a lot of the issues are behavioral. It can be hard to determine whether that's normal development or whether something else is going on. And even if you know that something else is going on, it can be hard to articulate or even evaluate as a parent, like, what is this and what do I do about it?
Right.
At Hope Central, when you go to see your doctor, if as you describe a behavioral health concern, the doctor just goes and grabs a behavioral health provider and introduces them, and actually the behavioral health provider can start working with you on that issue right away. So,
wow, right in the same appointment?
Yeah, right in the same appointment. So that really overcomes a lot of hurdles for accessing care. It also overcomes stigma, because if you're talking to your doctor, you might talk about a range of issues, and it's our doctor's initiative that says, what you're describing, that sounds like a good fit for our behavioral health provider. So you don't even have to go in saying, like, oh, I need help with mental health issues or behavioral health issues. Which is, a barrier for some folks, just saying, like, I really need that kind of help. And then what we end up doing in clinic, a lot of the treatment in primary care is functionally focused. So, for example, if a kid is depressed, we'll find out, like, well, how's that depression actually affecting your day-to-day life? Well, actually, I'm really having a hard time getting up to go to school. It's like, oh, okay, well, let's create some interventions that are really focused on that behavior, because that really improves your life immediately. And oftentimes, if you can work on that, that has a lot of spillover effect to the underlying cause. And you're really giving people skills on how to deal with behavioral health concerns. And then if there's needs beyond that, then we can make those referrals for further counseling. We can help coordinate that care and make sure that the services they're getting outside of primary care are really continuing to meet their underlying needs. So there's a lot of benefits for having behavioral health integrated.
Yeah, I like that a lot, because then it's like you're not, well, here, have some Prozac. You're actually trying to get to the bottom of what like you say, what the behavior is, what the routine is, maybe change up the routine to help the behavior, which is
And it's
so
also
awesome.
in the context of an ongoing relationship with your physician, right? So it's not a one-off treated in isolation. It's treated in the context of everything else that's happening with your health and with kids, over time as they develop.
Mm-hmm. Well, especially being a parent, you really don't know. Sometimes you're like, is this normal behavior? I mean, I'm like Googling things. Is this normal? I don't know. And so just being able to talk to your doctor and say, is this normal? And they're like, oh, yeah, that's totally normal. Oh, actually, let me have you talk to, and they just come in. Because I think there is, there obviously is a huge stigma, but to tell someone like, oh, there might be an issue, so let me refer you to so-and-so.
Right.
Like how many
Makes it a
people
bigger
don't
deal.
even call, or they build it up, which probably puts, a bigger issue on the child, but maybe not even has a behavioral issue. Right now you put this in their head, they have to go see a special doctor, right? So you just eliminated a ton of issues and probably, either solved problems for people that didn't even know they had a behavioral issue, or eliminated them even thinking they had one.
Yeah.
Yeah.
One dynamic that's a little bit hidden is that, most mental health issues for kids and adults manifest in primary care with doctors.
Really?
But doctors have limited training. They have some ability to deal with those things. But mental health is a little bit of a different beast. And so one of the big benefits of this integrated model is even if the patient doesn't necessarily touch both the medical and the behavioral health provider, there's a lot of hallway consults where the doctor can pull the psychologist aside and say, like, this is what's happening, and this is the advice I gave. Is this sort of like in the right direction, or is there, and the psychologist can sort of help pressure test that advice and make sure things are going well, and that just gives the doctor a lot more confidence to handle a much wider range of issues.
Yeah,
that's amazing.
it is. That seems like
That's how it should be.
it's so logical. It's like,
Yeah.
why don't they all work that way?
And again, this goes back to why we're a nonprofit, because even though, again, models like integrated behavioral health are recognized in literature as being really effective, the current pay system doesn't support it at all. Everything is fee for service, and these sort of brief interventions are not reimbursed very well. So it's not economically very sustainable on its own. It really requires us to be a nonprofit and to say, this kind of care is important. It needs to get paid for somehow. Will you support us?
So just so I'm clear, our insurance isn't paying for care at your clinic, right?
So actually, we are taking insurance. The reason that we also are a nonprofit is because insurance reimburses medical care on a fee-for-service basis.
Right.
So in primary care, if you make the intentional decision to spend more time with patients, it just means that you can see less, on any particular day, and your revenue goes down. And so to say, the only way to pay for like this deeper level of care is to sort of supplement what we get with insurance by folks that say this level of care is worth the additional investment. You see this happening in other other for-profit clinics as well, kind of in the other direction, people targeting the very affluent folks.
Yeah, they
and
just pay
saying,
more per visit.
Yeah, you need to pay, a subscription fee or a retainer fee, and I'm just going to focus on, 100 patients or something really small. And it's just that same dynamic of like, hey, it's not like rich people have a different body, that different, need a different type of care. Like, this makes sense for lots of people. So we're trying to make it work for folks with lower incomes by inviting the community to support what we do.
So I was going to ask next is like, who is your demographic? Who are your patients?
Yeah, it's a real mix, and a lot of that has to do with is just a function of us being in Southeast Seattle, which is really diverse economically as well as ethnically, and our intention is to try to have 50% of our capacity reserved for families on Medicaid and other low-income families. And there's a bunch of different reasons for that. One is because we're providing a level of service, a level of care that's usually really hard to access if you have Medicaid coverage. A lot of times if you're on Medicaid, you're seeking health care from what are known as community health centers. These places are great. And because of the way they're chartered by the federal government, they're really under a lot of volume pressure to see a lot of patients. And with that, they often do not have specialties like pediatrics. They have family care doctors that can see the broadest number of patients. So you don't often get access to the specialty. You don't get often access to the amount of time that we spend with folks. And so it really felt important to us from a sort of community care justice perspective to make sure that everybody had access to that. But we also feel like, healthcare is this unique opportunity where we, as people come, and regardless of your background, we have very similar needs. We care about our kids and we care about their development. And if a rich kid has asthma and a poor kid has asthma, like there's still like you want to give those kids the best care they can. And so we feel like, hey, there's an opportunity here to bring different kinds of people together that might not normally connect that much over some common fundamental health issues. So yeah, we have a real mix. A lot of professional folks coming to us because there's not a lot of pediatric practices of any kind in Southeast Seattle. We also are co-located actually in a building that is a homeless shelter for women and children. So we see a lot of those families as well. And it's great sort of on the other side of it to just see all these different kinds of families coming in and to know that everyone is getting, really excellent care.
So fantastic. Well, there's so many things we didn't even cover, but we're out of time, and I want our listeners to know how they can help support Hope Central.
Yeah. So several different ways. You can definitely come to our website just to learn more about us, hopecentralhealth.org. We would love if you have a pediatric care need for your child or a friend's child, just to check us out. When folks come to us for care, it really helps us care for the whole community. And certainly if you're moved to support us financially, would welcome your donations. We actually have a fundraiser coming up in the fall, October 14th. There's a little bit of information about that on our website as well. So I would love to meet you there. Perfect.
Awesome. Well, I did promise Rachel Wilson that I would throw her out, give her a little name drop. That's how I met you. She interns there as a psychiatric.
Yep, she's a doctoral psychology student, and she's interning with us as a behavioral health provider.
So I'm so glad she connected us and you were able to come on the show. So thank you guys for tuning into Financial Fitness. When we come back, we're going to have the Riley Johnson team market update. Today, we're going to talk about tax returns. So to find out about any topics discussed in today's show, you can always find us online at www.financialfitnessnw.com.